Hello, everyone. I hope you're staying safe and following guidelines to help reduce the COVID-19 disease spread. So, last video, I talked about common rumors about the COVID-19 vaccination and uh, try to provide some clarity on these issues, like the misconceptions. But today, I would like to speak on and look at the distribution and vaccination model, um, and what has been done uh, to correct the reduction in the immunization rate so far. So, according to the Gallup poll, um, the polling shows that 65% of Americans will be willing to receive the COVID-19 vaccine. Which is good, or we are headed towards, according to Dr. Anthony Fauci, is headed towards at least 80% of the population, so that we can have that herd immunity and reopen all businesses and get back to our normal life. So according to the Times newspaper, their model shows that, or um, their model actually shows that the percentage of US population that has been vaccinated is about 2.2%. That's come down to about 7.14 million people, and so far, different states have received uh, about 25 million doses of the vaccination, which is like which would cater for 7.3% of the population. So we are underperforming if we're just administering 7 million out of the 24 million doses. So most states have mostly followed the vaccine administration schedule given by the CDC, and a lot of people have followed this guidelines strictly, and you can see the different phases and the various timelines that states should implement these phases. So according to the figure I um I quoted before, 7.14 million people. That's really a low vaccination administration rate. That's too low for what we are planning to, or what Operation Warp Speed had intended to achieve by this period. So problems identified that has caused this reduced rate of immunization is basically um, basically at the local level. Um, we could see that a lot of most states have um, have vaccinated less than 50% of doses that they have been given. Most states have given less than 50% of the doses in their possession. So a deep dive to understand why these doses have remained in the freezers instead of being administered shows that a lot of states are strictly adhering to this schedule that has been um, handed down by the federal government, and instead of using it as a form of guideline. So apart from that, because of the third wave of um, the COVID pandemic that has put stress to our hospitals, we noticed that a lot of the manpower, the staff are being overworked and stressed. So that doesn't give room for too many staff to be able to uh, be available for this administration or this vaccination scheme. A lot of people have touted a lot of solutions to help with this vaccination effort, because having the vaccines in the freezers just doesn't make any sense. The idea is to get it into people's arms. So um, a suggestion could be that instead of following strictly these vaccination the schedules, uh, the state should look inwards and get flexible in the way they administer this. So instead of allowing vaccines to expire or stay in the fridge for a long time, when those that do not fit the phase show up for vaccination, we can be flexible about it and administer to whoever is free or available to get the vaccine. Also, um, a, a, a widespread vaccination campaign is really required, like in our radio station, TV, the main um, social media. There should be a widespread vaccination campaign at the local level, um, that shows where to get it, how to get it, you know, and steps to follow to get it. Because so far, I've not seen so many when it comes to that. Then we should also look to produce more doses, because as this is happening, we'll notice an increase. Therefore, we need to increase production to meet the needs, because with the increase in awareness and increase in people wanting to get the vaccine, definitely you need to increase production. So at the manufacturing level, we need to ramp up production of these vaccines. So, according to the new administration, they're planning to be able to vaccinate two-thirds of the population, about 100 million people, in the first 100 days of the administration, which is, a tall order, going by, the rate at which we are administering. Um, it is quite a tall order, and yes, it can serve as a timeline that we should be planning to meet up to. But um, basically, I want to suggest, like, the ability to vaccinate 10,000 people in large cities per day for the next 8 months will serve as a guideline to follow. 10,000 is not hard to achieve in a large city if we have large vaccination sites, large vaccination programs, um, awareness programs at our local level, social media, um, different at the level of the church, at the level of the the places we visit so much, the Walmart, Kroger, whatever, drugstores, CVS. There should be a massive campaign for the administration of this. And like I said, they should these facilities should be flexible with who they give this vaccine. You shouldn't like strictly adhere. It's the guideline, so you shouldn't just strictly adhere to the phases as brought down by given by the CDC. Whoever is on the line at that point, instead of allowing vaccines to expire, just administer these vaccines so that we can ramp up the immunization program and get our people to a better place. Thank you for listening.